Hello, I am Dipti Patel, student of Graduate Certificate Program in Public Health at University of New England. I am going to talk about Not on Tobacco, the evidence-based program. US Department of Health and Health Services reported that 1 in 5 deaths annually are attributed to smoking. In 2015, 25.3% of high school students use some type of tobacco products. With the current smoking rate in adolescents, 5.6 million of this population is expected to die prematurely from the smoking related illness. Research also indicates that those who initiate smoking early in adolescent age are more likely to smoke longer and heavily than those who start smoking as adults. So, looking at these statistics, it is really important to make public health efforts to prevent and control smoking in adolescent age group. Not on Tobacco program is a school-based group education program. It is based on social cognitive theory to bring about behavioral modification in teen smokers. Group education is provided in schools for 10 weekly sessions. It includes learning sessions on motivation, stress management, decision making, behavioral health modification to live a healthy life by integrating nutrition and physical activity to it. It also includes coping skills, interpersonal skills, and support to reduce number of cigarettes and help quit smoking. The Not on Tobacco program targets high school students, smokers between the age group 14 to 19 years. It includes students of both genders. It is extended to both rural and urban communities. Students belonging to all the races, including white, Hispanic, African American, American Indian, and Asian, are involved in the program. The goal of the Not on Tobacco program is that the adolescent smokers quit smoking at the end of the program. These public health interventions involving group education and support in schools to high school smokers would also reduce the number of cigarettes smoked in adolescent age group in a cost-effective manner. At the same time, the program would prepare the teenagers to manage the stressors in life and encourage adoption of healthy lifestyle. The key statement for Not on Tobacco adolescent smoking cessation program is that this program would significantly decrease smoking and increase quitting rate in adolescent smokers. Let's talk about the social factors affecting the adolescent smoking behavior. Motivation to begin and continue smoking is strongly influenced by the siblings, friends, and parents who smoke, accessibility to the tobacco products, and self esteem. A study has shown that peer pressure leads to a linear increase in smoking from age 12 to 17. When their friends smoke, all the social activities in which they participate involve smoking. Teens are very concerned about being accepted in a peer group, and if smoking helps them do that, they are not ready to quit. Group education in school was a very good public health initiative, as now we are creating awareness and the whole group of friends taking care of the peer pressure to some extent. Social norms also play a role in smoking more cigarettes. This is due to misconception of what would be considered normal in the community. Through group interventions, we are influencing the basic idea behind smoking for the whole group. We are not focusing just on the behavior. That makes it more effective. Positive parenting style and support from parents to help quit can increase the effectiveness of this program. There are several diverse perspectives of the target population affecting the program. A study conducted with Appalachian teens in North Carolina and West Virginia shows that 8.1% of NOT participants reported smoking cessation 3 months after intervention, as compared to 2.2% undergoing behavioral intervention. This difference, however, was greatly attributed to the females participating in the study. It might be contributed to the groups consisting of same-sex teens and same-sex facilitator. This way, the gender issues are addressed in a better way. Differences have been observed between effectiveness of smoking cessation in rural versus urban population. This is attributed to the difficulty in access to healthcare and smoking cessation programs in rural population, leading to lack of awareness among rural communities. Also, adolescents who are committed to academic success have shown lower levels of smoking. By incorporating stress management in the curriculum, the program helps the students deal with stress related to academics. The program encourages teenagers to live a healthy lifestyle by including physical activity and healthy eating. These teens also stay away from high risk behavior. The NOT program addresses the public health priorities of health equity, strengthening research and evaluation by assuring data availability, working in collaboration, and healthy communities. The smoking cessation program does not discriminate an individual based on race or ethnicity, gender, socioeconomic condition, and geographic location. Thus, it addresses the public health priority of achieving health equity. Ongoing research is conducted at Prevention Research Center, West Virginia University. The data from the programs is made available to Research Center. Through the use of this data, reports are published. This further helps to strengthen the public health interventions. American Lung Association and West Virginia University are working in collaboration to effectively implement this program. Integrating sessions on nutrition and physical activity promotes the teenagers towards living a healthy lifestyle. This also keeps them away from other high risk behaviors. Now, coming to the infrastructure of the program, CDC Prevention Center, American Lung Association, University of West Virginia worked in collaboration to start the Not on Tobacco program. A mutually beneficial approach was adopted to run this program. The West Virginia University Prevention Research Center conducts research about factors affecting the use of tobacco. They also provide the scientific oversight on the program by collecting and evaluating the data about the program and publishing reports. This research center activities are funded by CDC through a grant. American Lung Association works on implementing the program. The American Lung Association has highly experienced trainers and staff who act as program manager, state coordinators to provide program oversight. The regional coordinators are chosen from the community as they need to be familiar to the local youth and schools. They train the facilitators and also work towards gaining support from the school organization. They also coordinate with the funding sources and research center. The external stakeholders are the people or associations who are directly or indirectly influenced by the execution of the program. The high school students and their families are the major beneficiaries of this program. The schools where these programs are run are also affected as the students who participate in programs start adopting healthy lifestyle and indirectly influence other students. Public health associations of the Appalachian states, including Florida, North Carolina, Virginia, West Virginia, Wisconsin, and Colorado, got involved in implementing the program in their states. The American Cancer Society, American Pediatric Association, American Association of Preventive Medicine is conducting research about the effectiveness and reducing burden of tobacco-related illness. The healthcare dollars spent to manage the tobacco-related illness are greatly reduced with the effectiveness of this program. Thus, the effectiveness of the program affects the federal and state funds. Media, community health workers, family practitioners also play a role in promoting the program. Community resources can be used while implementing this program. A self-assessment questionnaire, why do you smoke, can assess the motivation behind smoking for teenagers enrolled in the program. The primary care providers, teachers act as resources to identify the high school students who would benefit from this program. Education material is provided about the harmful effects of smoking. Facilitators are the community members who complete the training. School organizations also play a major role in conducting these learning sessions in their institution. Funding was provided by CDC through a grant entitled in 2001. Also, state and federal funding for the tobacco cessation could be used as a resource to run the program. This could be also possible through the NIH-sponsored grant opportunity. Let's talk about the ethical concerns involved in the delivery of the program. The ethical concerns and the delivery of the program where the recruitment barriers, dropout, lack of long-term follow-up, self-reported quit rates, confidentiality, and parental consent. All the school staff, volunteers, and facilitators of the program are routinely trained on confidentiality and security practices. Students' consent is also made necessary for disclosing the student's information for any purpose. Even before a student participates in the program, parental consent is obtained. Research shows that lack of interest in program and inability to obtain parental consent were the two major recruitment barriers for this program. as many students didn't wanted to tell their parents about their smoking. Active recruitment techniques involving one-on-one conversations were used to increase the number of students participating in the program. Low school attendance, which goes hand in hand with high risk behaviors, was observed to be another barrier for the implementation of this program. It is observed that follow up cannot be maintained for some of the participants who drop out before completion of the program. So, it is argued that compliant analysis does not provide a valid assessment of the program outcome. Other limitation is using the self-reported quit rate rather than biochemically validated quit rate. A study has shown high agreement between the two. Long-term follow-up is also lacking in most of the studies. Though long-term follow-up is important, it may hamper confidentiality and privacy as it would require sharing of contact details of the student. Opponents of the tobacco cessation program. The Appalachian states where not on tobacco program was implemented are the major tobacco growing communities. Major part of the workforce is reliant on tobacco growing for income. They received an opposition from these people while implementing the program. Also, the tobacco companies are the major opponents of the program. The political ties of the state government with tobacco industry also determine how the tobacco control legislation would be implemented.